Hello everyone. In this Docplexus exclusive interview, we have with us renowned oncologist Dr. B.S. Ajaikumar. He is the chairman and the CEO of Healthcare Global Enterprise Limited, and he is the organizing chairperson of the International Cancer Congress 2016. Dr. B.S. Ajaikumar has over 35 years of experience as a radiation and medical oncologist. He currently heads over 20 cancer centers across Asia. In this talk, Dr. Ajaikumar will discuss about the changing landscape of cancer care in India and across the globe. Thank you, Dr. Ajaikumar, for sharing your valuable time and knowledge with us. First of all, congratulations to you and your team for organizing such a huge event.
Thank you.
The theme of this conference is changing paradigm in cancer management. So can you please elaborate about this theme and why you particularly chose this theme?
Yeah, when you look at the historical background of way we treated cancer, we continue to treat, it was based on, when you look at how in the past we have treated cancer patients, evidence-based medicine and a treatment based on a certain tumor like pathology and staging based on certain parameters, we have not really made great headway in conquering cancer. And today we believe cancer should be chronic disease, and like any other lifestyle diseases, it can be treated and controlled even if it is not cured. So the paradigm shift in cancer care has happened in the last decade or so, where we are now focusing more and more on precision medicine. What that means is we analyze each patient based on their personal data, based on their history, genomics, and certain parameters like molecular imaging. We will be able to say what is the right treatment for that patient. Cancer, can be conquered or managed properly only if you treat cancer the right way the first time. Historically, particularly in India, because of economic reasons, saying we are a poor country, lack of technology, lack of knowledge, we have had poor outcomes in cancer. But time has come where, obviously there is more affordability, and the technology has been brought into India across cities. Private enterprise has played a major role in it, where, HCG itself, we have, like 17, 18 cancer centers, where even in smaller cities, which was not thinkable in the past, like Ranchi, or now in Nagpur, Cuttack, we have brought in high-end technology, linear accelerators. In the past, people said, we can't bring in because it is not financially possible, viable. But today we are very proud that we have made it accessible. The most important thing in cancer field has been make it accessible, make it affordable. At the same time, make sure you don't compromise on what treatment you give because of their economic status. So we have innovated model where we can do that, treat all sections of the society, and most important thing is properly stage. You have to use molecular imaging, molecular diagnostics, genomics. You should take time. And so you profile the patient and accordingly you tailor make the treatment. That is when you will get best results. See, the cancer issue has always been fear of cancer. Cancer means dreadful disease. The reason it is dreadful is considered because we have not properly addressed these issues. Once you address these issues, it should become chronic disease like diabetes, and we don't fear diabetes now. We know there are a lot of treatments. Similarly, we should manage cancer. And some of the terminology we use also will stop. For example, unnecessarily using palliative care. Now, where does a diabetologist use palliative care? It doesn't use. So we should stop using. There is a time and place for everything, but not routinely, and using like advanced stage 4. So these are terminologies which create tremendous fear to the patient. So we should remove those and be very precise, saying, look, this disease from your, for example, breast cancer has spread to bone or liver or is contained. Explain where it is and what is the treatment. Be precise and administer precise therapy where you get better outcomes.
So in your opinion, which is the biggest challenge or dilemma for an oncologist?
Yeah. See, the biggest challenge is today with all the internet, information technology, we have the knowledge. Everything is available. India is now, we ourselves are doing a lot of trials and all. The challenge is for us, one is economics. When people think it is expensive, when you cut corners, obviously the outcome will be different. So when patients cannot afford, the challenge is how do you create a model where even if they cannot afford, they can get the right treatment. And that is what we have attempted to do very successfully. Harvard Business School has written about us, saying how you innovate model, capacity utilization, making sure cross-subsidy happens. So this is one challenge. The second challenge, used to be in the past getting the right experts, the oncologists. But fortunately in India, we have now more and more oncologists coming out and using technology like telephysics, teleradiology, telepathology, virtual tumor boards. We are overcoming this because we don't have to have major experts in all tier 2, tier 3 cities. If a patient goes to, let's say, Ranchi, even if the experts are there, somebody sitting in Bangalore can give them the opinion. So with this, we can overcome some of the shortfalls of having highly trained people in all corners of India. Similarly, pathology. We can't have an expert pathologist in Ranchi or Cuttack, but you can have telepathology where I can read the slide in Bangalore and give them the opinion, my experts. So this is how we are trying to overcome the challenges we face.
So as you just mentioned about digitalization and a lot of trial being conducted on a daily basis, and as we know that oncology is a very research driven field. So can you tell us about any promising recent researches or any
Absolutely. One of the things is today instead of giving generalized chemotherapy, we are now giving more and more targeted treatment. There is tremendous research going in targeted therapy as well as in medical oncology field, immunotherapy. We ourselves participate in certain immunotherapy. We have done our own like dendritic cells, T cells, and today there are a number of immunotherapy drugs which are going to come to India. Unfortunately, they'll be expensive to treat certain diseases which was thought to be not treatable in the past. For example, lung cancer. Years ago when patient had lung cancer, it was all gloom and doom. Maybe 6 months, year, 18 months. Today, with immunotherapy and proper staging, these people can live for years. So there is a major change happening in the field of oncology. Similarly, in radiation, precision. We have Medicaid that like cyberknife, radiosurgery, tomotherapy, which will be so precise, they are giving only treatment to the tumor and not giving any treatment to the normal tissue. So the side effects will be minimal, it will be precise, and we get far better outcome. Surgery also, we have robotic surgery. So all this technology, minimal surgery, now we do minimal surgery. All this integration into multidisciplinary clinic has made a major change in the approach to cancer care.
So like you just mentioned about targeted therapy. So how do you think radiation oncology will play a role in that?
Radiation oncology, we are now talking about radiogenomics. Apart from being precise radiation like IMRT, IGRT, radiosurgery, we are also looking at analyzing the genomic sequence of patients, which we started doing. And based on the sequencing, we can decide who are the people who likely respond to radiation, who will not. So we can stop treating patients who are not going to respond. It will be huge cost saving, less side effects. So overall, it becomes, in a way, very positive to the cancer patients. So we are giving right treatment at the right time. So radiation also is undergoing technology, software development, precision is undergoing massive change, and it has already undergone. We are very, very happy where we are able to deliver radiation to the patients today.
Dr. Ajay, you previously mentioned that there is a lack of specialists or oncologists in India. So do you think that general practitioners can help oncologists in in some matters, or they can help in
if we
management?
can have enough training programs and using technology again, can be done. I think interested general practitioners certainly can do follow-up, can certainly participate in management of the cancer patient along with the specialist. This will certainly lessen the burden to the specialist. And also people who come from faraway places, what we have done in focused areas is to train the referring doctors so they themselves can do the follow-up and refer the patient to the main center as and when required.
So do you think an online platform like online professional networking platform like Docplexus can help doctors and educate them about cancer?
Absolutely. I think this is a way to go for the future. This bypasses patients, doctors traveling, and obviously busy doctors cannot. And I think some of these online way of doing today it is virtual. Online is almost like you are sitting next to me. I think with this kind of technology, it will certainly enhance the possibility where the primary doctor can work closely with oncologists and establish protocols, systems in place to deliver the proper care to the patient at their own doorstep.
Thank you so much for sharing your valuable knowledge with us. Thank you.
Sure, thank you.
To stay updated on our latest KOL videos and interviews, please follow us on Twitter, like us on Facebook, and subscribe to our YouTube channel. Happy Docplexing!